I don't know what people keep using these drug tests for, but I'm here to explain how to really make these things effective in fighting drug addiction. Hey, what's going on, everybody? This is David Brooks, the Cadillac Counselor, coming at you to tell you a little piece of my mind. And I've been asked many times about drug tests. Parents come in to ask me, social services, probation, all of the judicial system. But I'm going to explain really what drug tests are for. And I'm going to explain how to make them effective and then how to really help people change. Before I get into anything, I want you to subscribe. 2022 is going to be a major year, and I'm going to be explaining a lot about the criminal world and how to get out of it. The main thing I want you to understand about drug tests is that they should be used only in two different ways. One, if you are providing therapy, drug tests should be used differently. If you have no way of giving therapy, then drug tests are only used for accountability. That's it. In the therapy world, drug tests should not be really about accountability as much as helping the individual change. Agencies contact substance abuse providers and always want a lot of drug tests. Make them drug tests every single time they come in. I want a drug test. How does it? Now, I get it. Now, if you in your agency wants a drug test to be given, then that's a whole lot different. That's something that you need to do. Now, if it comes down to treatment, it is supposed to be on a random basis and used as a therapeutic intervention. Now, if you're at home and you just want to know if your child or your husband or your wife or your daughter or whatever family member is getting high, then use it. You're not using it for therapeutic interventions. You're just using it for accountability. Halfway houses, schools, whoever wants to use them, always know exactly what you're using it for. The first thing I want to say about drug tests, if you don't see the urine go straight from the person's body, this doesn't mean anything. That's why, for me, I like to use oral swabs, because I can look them right in the face as they're pulling it out of their mouth, and I know for a fact that it's theirs. I've had people trying to use bleach, all types of products to try to get these tests to read negative. They even got little fake wee-wees that will get urine into this. I've seen people stopping at stores, filling up condoms to fill up urine, and then poke a hole so that it can make the sound of urine hitting the cup. People, if you think this for a second, just getting a drug test means anything, or if you just want it just for your records, go ahead. But for me, in Brooks Behavioral Health Services, these are pretty much obsolete. I'm more into the behavior change. Whenever I use drug tests, I make sure that it's on a random basis. Most time, I don't even like to talk about drug tests as if it's not even an option on the table. The reason why I do this is because I want them to get comfortable in the therapeutic process. If I start pulling these cups out all the time, people will stop coming into treatment. Especially if they've used or if they've relapsed, they just don't want to come in because they know these are coming down the pipeline. So what I do is I create the atmosphere for people to just tell me the truth. Now, you might say, well, how do you know they're telling you the truth? You can see straight through the person and see the guilt and the shame. So this is how I work it. The client walks in one day, I ask them, how's life treating you? Everything going good? And they go, oh yeah, everything's going good. Life is just wonderful. I say, okay, you know what? Today we're going to do a urine. Just for the fun of it. Just to put it on record. Next thing you know, the person starts getting nervous and they start kind of leaning back, kind of hands started shaking. That's when I know something's going on. I say, hey, man, you seem kind of nervous, man. Come on back here and take this urine for me. Next thing you know, the truth comes out. They say, oh, man, I just want to let you know, man, I did something this weekend. That's where I make it a therapeutic intervention. Because then I explain to them this, and this is just how I work. I tell all my clients, don't let anything tell me that you relapsed except you. I don't want to know from a test, I don't want to know from a person, and I don't want to know from an agency. If you use, I want to know from you. And if you tell me, we can do this a whole lot differently. Most programs that people have that are in substance abuse, all they do is drug test. You know why? Because they're not really looking for change. What they're looking for is just accountability. Now, if you have a program and they're mostly non-master level clinicians, most likely you're going to use this as your main way of accountability. I always use every drug test as a therapy. The reason is that the goal is to get people to change. I even know when I was on probation, I never changed. All I did was make sure that my urine was clean every single time I went in. I knew the calendar. If it was cocaine, I knew 3 days. PCP, 3 days. Marijuana, I left the marijuana alone because it was too hard to clean out of my system. So I know that people are always faking the system. Watch orals. Listerine, some of those tactics does work on some of them. But for my drug tests I sent them, I use Precision. And Precision always gives me the best readout that I can get for drug tests. I like to use them because they check the metabolism, the enzymes, and the metabolites. Because sometimes the drugs might not be in the system, but the metabolites still are. And I want to know even further. So like maybe 3 days for normal drug tests. When I use Precision Diagnostics, they always give me a little bit more. Maybe even up to 5 to 6 days. And that's why you have to get you a really good drug testing center. Those just cups, those instant cups, trash. Never use them. Now if you want to use them at home and that's your thing, go ahead. But anything that is ever reported to any type of entity, it should be where it is tested and approved in a lab. I don't trust instant cups. I don't trust instant orals. Because the goal is you want to know every aspect of that person. We know relapse is part of recovery. If we always are drug testing people, you never allow the person to truly change. All they do, they just start to escape, manipulate, and they go right back into their drug-using mindset. And that's the key. You don't want them to go back into drug-using mentality, so that's the reason why you try to keep them from hiding. Make them be straight up. Make them tell you. Now you might say, how do you make someone tell you? You gotta start with the rapport. If you don't have a rapport with a client, you can never get them to truly tell you the truth. And in my program, that is the first thing they always hear. You need to be honest and tell me the truth. Now you might think that doesn't work, but it does. And they come in and they tell me the straight, honest truth. They tell me how they relapsed, how they went about it, what mistakes they made. Now if you make it a punishment, they will never tell you the truth. And if they can't tell you the truth, when will they ever change? It's David Brooks, the Cadillac Counselor, coming at you to give you a little piece of my mind. Take it easy. Bye.